When Asian American and Pacific Islanders experience racism, isn't the hope that family support can buffer the pain of those experiences? And wouldn't we also consider how the type of attachment to parental figures impact that process as well? We speak with Dr. Lydia HaRim Ahn, who shares her recent publications on attachment security and racial socialization. So stay tuned to this informative episode as part of our AAPI Heritage series. Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Zen. We're honored to speak and host Dr. Lydia HaRim Ahn, an assistant professor at Arizona State University, whose passion for understanding the complexities of racial identity, discrimination, and mental health is nothing short of remarkable. Dr. Ahn's journey is a powerful testament to the impact of focused dedication and a heart for social justice. From her groundbreaking research on the effects of subtle racial discrimination to her work on racial socialization in Asian American families, Dr. Ahn is at the forefront of creating meaningful change. She had a recent publication on Asian American mental health help seeking, an Asian valued informed health belief model in the Asian American Journal of Psychology. A decorated scholar, Dr. Ahn's accolades includes the Counseling Psychologist Journal Best Student Paper of 2022 and the APA Division 35, Section 5, Jean Lao Chen Early Career Professional Award for Academic Scholarship. Her work not only earns recognition, but more importantly paves the way for a more inclusive and empathetic approach to mental health. And beyond the accolades and publications, Dr. Ahn is a mentor, an educator, and a force for change. She's shaping the next generation of counselors and psychologists, and she's deeply committed to community service. As an Asian Korean psychologist, Dr. Ahn will be sharing a synthesis thus far in her research on AAPI families and racial socialization. Dr. Ahn, thank you so much for agreeing to be on our podcast.
Thank you so much for having me.
We're actually doing this in preparing for the AAPI Heritage series. Why don't you just dive right into maybe a couple of recent publications?
Yeah, so a lot of my work recently has been focused on Asian American families and specifically looking at racial socialization and kind of how it interacts with other family processes. So some papers that I've recently published on this topic are, for example, looking at whether attachment security is a buffer to the effects of racism on mental health of Asian American adolescents. We've also looked at how racial socialization and how parents talk to their kids about culture and how college students internalize racism, how that contributes to family conflict and self-esteem, as well as a paper on racial socialization, so how parents talk to their kids about discrimination and systemic racism, as well as experiences of discrimination and how that's associated with attachment and advocacy as a coping process.
Wow. So these are big topics. And so I'm wondering about, big takeaways for our listeners. So let's talk some more about the secure attachment papers, just because I have some biases possibly about this, or maybe we can critically examine this.
Yes, definitely. And so the first paper that I want to talk about is the paper about attachment security and whether it can serve as a buffer or moderate the effects of racism on mental health among Asian American adolescents. This came about partially because of a theory paper and some of my clinical work as I was learning in graduate school about attachment theory. This was my first introduction to attachment theory. I became very interested in it as a psychodynamic and interpersonal clinician. Those are my theoretical orientations. So I became really interested in it. And research-wise and also clinical-wise, clinically, I'm very interested in how to most effectively work with clients of color and marginalized populations. And so I was really thinking about, okay, if clients are more securely attached, whether that's to their parents or to romantic partners, peers, etc., theoretically, I thought it would make sense that, if they experience racism, they just have someone that they can go to as a secure base. They can talk to, they can process these difficult experiences with others. They may not internalize it as much or take it like it's something wrong with them, that they have just more coping, they have more resources, whether that's both internal and externally with other people.
Yeah, that totally makes sense. And so when you're looking at this from a theory approach, and these are with adolescents, AAPI
Yes.
adolescents,
Yes.
and what did you find?
We actually found that secure attachment with fathers, so the more securely attached that API adolescents were with their fathers, it actually wasn't enough to mitigate the effects of a lot of experiences of racism on mental health. So if Asian American adolescents, the more racism that they experience, even if they were securely attached, they still reported greater distress.
Interesting.
And so,
And why would fathers and not mothers, just out of curiosity?
don't know. So with mothers, we did just find that secure attachment was associated with better mental health, but we didn't find an interaction effect. Not sure why. Maybe like our explanation was that oftentimes there's something gendered going on where maybe they're the primary caregiver, and
Okay.
but we're not sure exactly why with mothers. But we found that specifically with fathers, even if they were securely attached, it just wasn't enough.
So I want to be clear about this. So it's with fathers, it was not enough, but with mothers, it was enough.
No, and that's not the case either. So there
Oh,
was
that's
just,
fascinating.
yeah, secure attachment with both mothers and fathers were directly related to better mental health. So the more that they reported secure attachment with mothers and with fathers, that they in general reported better mental health. In the context of racism with fathers, the more racism they experienced, it wasn't enough. With mothers, just no findings.
Wow. So I'm going to state my bias here, which is part of me wonders if I wouldn't say the push, like, you were talking about in graduate school, you learn about these different attachment styles, and then same as in graduate school, learning these different attachment styles, there does seem to be a push towards secure attachment as being the gold standard type of attachment style. When we
Yeah.
don't look into, well, maybe there is an adaptive reason why this particular attachment style is actually healthy for this population. And I refrain from using words like insecure attachment and anxious attachment because there is this bias, there is this negative connotation associated with that type of attachment style, rather than looking at it from holistically. Folks in, the attachment style, like in China and Japan, right? It's like, well, anxious, avoidant, well, okay, well, anyways. So that's why I do think that, these findings for me seems to suggest, wait, for one, I mean, I'm not so sure we need to place so much emphasis on the attachment style for secure.
Yeah, I think you make a great point. And actually in the study we found, which is consistent with previous literature, is that API adolescents in our study reported the greatest amount in terms of avoidant attachment. And that seems to be relatively consistent. And so I do think that there's a lot of research that needs to be done on specifically Asian Americans and attachment and what that might look like. Why might that differ? Like in the other study, we did find, for example, that racial socialization experiences might contribute to some attachment processes. And so that there may be just additional factors that can be associated with maybe attachment change over time, with secure attachment, other forms of attachment, that it may look different across cultures, even though it is considered also like a in the literature like a universal
Yeah.
construct.
So, yeah, that's just my reaction in terms of the takeaway of this particular finding, which is that should we be pushing towards this so-called secure attachment when the data shows that for AAPI adolescents who experience high forms of racism, is this really the way to go? You know?
Right. And I think some of the clinical takeaways is that, oftentimes as clinicians, as mental health therapists, we often do focus on families and think about parents and explore a lot about family processes and how that impacts mental health, which I think is great and needs to continue. And thinking about, okay, what are these more macro system level factors that may also be contributing to mental health? Is that a client can come with, they can have a great family relationship with their parents, with their caregivers. They can be quote unquote securely attached to their caregivers, and yet they still may be in distress because they may have experienced a lot of racism.
Yeah. Yeah, and it makes me think, wait, just because you have a secure attachment shouldn't, I guess, necessarily eliminate your distress from racism. Yeah.
Yes. And that's what our study exactly finds, is that, it's not enough to even have like a strong, family support system, right? That might not be enough, that we really need to focus on dismantling these experiences of racism to improve the mental health of these adolescents.
Oh, wow. I love that takeaway, actually. And that's a big point. Yeah. So here we're talking about this paper on attachment style and as a potential buffer for racism. Tell me a little bit more about this other paper that looks at race socialization in AAPI families.
So this other paper that we published in 2024 with my students is how factors contribute to intergenerational family conflict, and in turn, Asian American college students' self-esteem. And so we looked at whether maintenance of heritage culture as a racial socialization strategy. So what that means is parents talking about culture. So that can be, making cultural food, celebrating holidays, speaking in the language. And on the other hand, college students internalized racism. So if they think, for example, Asian Americans are more inferior to other races. So those two factors and how that contributes to this intergenerational family conflict within the family. And we found that these were associated. So parents who are really trying to stress about
Got to know your roots.
Got to know your roots, got to know your culture, that does contribute to more family conflict. And then children who have greater internalized racism also contributes to more intergenerational conflict. I think it makes theoretically a lot of sense, right? That they're just growing up in their experiences of parents and children are very different. Children are growing up in a world where it makes sense that they may internalize these experiences of racism, and that contributes to conflict in the household. Parents are really trying to continue, right, passing down their culture. And the main takeaway of this is not that, we need to stop, right? Parents need to not. I think it's great, and they should continue to socialize their children, but rather just the complexities of living in the United States when the world is telling, right, these families that maybe something is wrong with their culture or it's bad, right? And that this can just create conflicts in families, and it can create the need for difficult conversations.
Okay, so do you have any final thoughts about these two papers that you've conducted?
Yeah, I think one of the important takeaways, especially for this second paper, is that we need to really just think about how these larger macro systems and the environment are affecting the family unit and family processes within AAPI families.
Yeah. Thanks for doing this work in investigating these questions, because many clinicians guess, or use a theory to approach in working with their clients, and sometimes it's more helpful, or just as helpful. It supports when we look at the data. I'm actually just curious, in thinking about this particular paper, with the experience of race socialization and internalized racism, is it looking at more like, I don't know if the paper looked at the students' racial identity, like, like, are they more like assimilation? Are they integration phase? I'm actually wondering about that.
It didn't, but I think that would be a great question is, maybe it's dependent on racial identity and whether how they experience these types of messages
Yeah.
as well.
Yeah. Okay. Well, Dr. Ahn, thank you so much. Do you have any final thoughts, or maybe a consolidation of the research, the years of research that you've been doing?
Yeah, I think just overall, both in family therapy and individual therapy, not being afraid to broach these topics is being able to ask about the types of messages about race and racism that they receive growing up from whether it's their parents, caregivers, and even just broader, right, from other people, and how that impacts them, if at all. So not being afraid for, as clinicians, to be able to explore and talk about these topics,
Yeah.
I think will be important.
Yeah. It's an experience. I think this highlights the importance of addressing culture, race, and recognizing privilege, whereas, white counterparts probably aren't going to be having these experiences of parents saying what it's like to be white. Whereas for AAPI clients, hey, we're trying to transmit this culture. And of course, this is more so probably stronger from a first generation immigrant perspective.
Yes.
Yeah. Well, Dr. Ahn, thank you so much for sharing these papers, and we'll definitely link it on the show notes. And again, thank you so much for your work and being on our podcast today.
Thank you so much for having me.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.